Hello, everyone. Thank you for being here today. My name is Heather Ulmer, and I'm a master's candidate in the Indigenous Health stream of the MPH program, and I'm very grateful to be here today to share with you a bit about my practicum project. So I'd actually like to begin by sharing something that I've learned throughout my master's is the significance of introductions and acknowledgements, and that introducing ourselves can be a means of acknowledging our worldviews, our connections to our communities, and helps position ourselves within our work and is an important practice in working towards decolonization. So I'd like to begin by sharing a little bit about myself in relation to my project and presentation. So I've just shared some photos of my family. I found a photo with all four of my grandparents, which was cool. I am a settler of mixed European ancestry, and the top photo was taken in Treaty 6 territory, which is where I was born and raised, and which are the traditional lands and meeting grounds of many First Nations and Métis people. I recently moved to Victoria, and I would like to humbly and respectfully acknowledge that I am a grateful and uninvited guest on the traditional territories of the Lekwungen and Tsimshian speaking peoples. I've also had the honor of working within the community of the Vancouver Downtown East Side for the past 5 years, and that is located on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I would like to acknowledge the tremendous support of my amazing practicum mentor, Dr. Charlotte Lopi, and I'm also very grateful to the old ones, elders, community members, students, and faculty who shared their time and knowledge with me throughout my practicum, and for the support of my family, friends, and colleagues, some of whom are here today. Thank you very much. So for my practicum, I had the opportunity to work with Dr. Lopi on a CIHR operational grant to create what's called a network environment for Indigenous health research, or NEAR. And the purpose of the NEAR centers is to promote the priorities, wellness, and self-determination of Indigenous communities through supportive research environments. The proposed funding will support a network of 9 NEAR centers across Canada, and the BC NEAR is in partnership with the First Nations Health Authority, BC Association of Friendship Centers, Métis Nation of BC, I think my hair is making noise, sorry, and other First Nations community partners. During my practicum, I was able to contribute to synthesizing the grant funding requirements and supporting the preparation of grant materials, and I also had opportunities to accompany Dr. Lopi to various community gatherings, meetings, and presentations. So for my project, and in support of the NEAR grant, I undertook a synthesis of the literature around the context and processes of Indigenous community-led health research in Canada, with a focus on identifying wise practices, recommendations, and gaps in the literature. So very quickly, I conducted a keyword search, and I ultimately ended up with 20 articles that fit my inclusion criteria and were included in analysis. And through thematic analysis, I identified 4 primary themes, and those were respectful, reciprocal research relationships, Indigenous knowledge systems and research paradigms, capacity development, and knowledge translation, mobilization, and engagement. And I'll just go over some key findings of each of those themes. So relationships were really a key theme that resonated through each of the articles, and many of the authors emphasized the importance of humility in relationships, taking time in relationships, and maintaining relationships. The literature discussed the importance of understanding the historical and political contexts of research and how these impact research relationships, emphasizing also the need for researchers to build relationships based on reciprocity and mutual respect, for research to be community-driven and responsive to the community's needs and priorities. Many of the authors discussed how building relationships and engaging in community-led research can require significant time, effort, and resources, and that this needs to be reflected in the policies and requirements of funding institutions and academic institutions. Relational accountability was also an important topic within this theme. One of the articles suggested that as a measure of accountability, it be required of researchers to describe their relationships with communities, and that research ethics boards should evaluate the strength of community research partnerships, measures to ensure community ownership and control over the research, and respect for community protocols. The second theme that emerged was the importance of grounding research in Indigenous ways of knowing and being. Some of the articles described integrating Indigenous knowledge systems with community-based participatory research and described how this had the potential to integrate local knowledge and protocol and to promote knowledge exchange and reciprocal learning. However, some of the articles also described that despite the strengths of CBPR, there's a need for a greater emphasis on the development of Indigenous research paradigms and methodologies. Some of the articles discuss the significance of incorporating ceremony into research and the importance of the inclusion of elders, knowledge keepers, and youth. For example, one study described hiring local youth to support interviews with elders and how this allowed for their meaningful inclusion in the research process and also created a space for intergenerational knowledge sharing. The third theme was capacity development. And an important element of this is recognizing and mobilizing the capacities and strengths that exist within communities, as others have talked about today. And many of the authors emphasized the need to shift the focus of research from deficit-based to strength-based approaches. Common capacity building strategies were training and employing community members, as well as holding workshops with community members, researchers, and students, and how this created opportunities for reciprocal learning and capacity development. There was also a clear call for increasing the capacity of non-Indigenous researchers and institutions to better prepare to partner with Indigenous communities. And many of the authors emphasized the importance of allowing communities to hold and administer research funds, and that communities should be supported in leading and controlling the research undertaken in their communities and traditional territories. So the final theme that emerged was the role of knowledge translation. There was a strong call for research to lead to tools, action, and resources, and for researchers to seek community direction and feedback on knowledge translation strategies to ensure these are relevant to the community's protocols and priorities. Other recommendations included establishing data sharing protocols, seeking consent to publish and use information, and the benefits, again, of meaningfully including youth and elders in knowledge sharing processes. So there are also some gaps identified in the literature. There was minimal literature space specific to Métis health research priorities, suggesting a need to increase funding and support for Métis-specific research and engagement. Another gap that was identified was the underreporting of the relationships between researchers and communities, and the processes of seeking community consent for research. One of the articles actually also acknowledged that there was minimal reporting of Indigenous authorship within research studies, and this is significant given the call to increase the meaningful representation of Indigenous peoples within research and academia, as well as to increase the accountability of non-Indigenous researchers to their work and relationships with Indigenous communities. So I'd say the main limitation was limiting the breadth and scope of the literature synthesis to be completed within my practicum. And putting this all together, for me, I think perhaps the most significant theme to draw from the literature is that all of these key themes, wise practices, and recommendations that were identified are all interconnected and integral to community-led research and self-determination. And I think it seems that the near centers will be well situated to strengthen Indigenous health research in Canada. So there are many wise practices being used in Indigenous health research, and there's still a need to make space for Indigenous leadership and knowledge systems to critically examine academic and funding policies and systems, to actively work towards cultural safety and decolonization within these systems, to improve training for non-Indigenous researchers, and for a commitment to ongoing relationships with Indigenous communities. So just to kind of conclude and as some final reflections, I would again like to thank everyone who supported me during my master's and my practicum experience. And this has been an incredible learning journey, and for me it's part of a lifelong journey, and I hope to continue to develop my knowledge and skills as a public health practitioner and to continually work towards decolonizing my professional practice and daily life, rather. Thank you.
Thank you. So questions? Why is it always over there? Actually, it's great. I get to check out to see what people are snacking on my way over.
I'm sorry if everyone's so sick of hearing my voice. Awesome presentation. Thank you so much. I appreciate the sharing and wondering if I can read your report. I feel like I've asked everyone that. Anyway, so you mentioned how ethics and grant standards are something that kind of need to be changed, and they often require disclaimers of researcher to participant relationships and kind of frame them as potential conflicts of interest. And that's obviously a huge barrier in the whole needing to build relationship and that kind of thing. So I'm curious if any specific things came up, or if you had any specific suggestions around how to address that. Like, should there be separate ethics and grant applications, or should just the entire mainstream system of applications and ethics and all of that be changed to account for that?
Mm-hmm. Yeah, thanks, Madison. That's a really great question. I think there's many parts to that. I think there's generally a need to look at kind of funding for research and general policies. I was able to participate in some meetings with community members and Indigenous scholars and students, and there is a lot that's happening to actively work towards working with the Tri-Funding Council to kind of look at how we can make kind of these systems and requirements more congruent with Indigenous research contexts. And then I think also one thing that I learned about was even just having community Indigenous research ethics boards that specifically look at Indigenous research. And again, this is really exciting that I think that's kind of a need that the NEAR might serve to support and fill is kind of how to navigate that. And I think the NEAR centers will be really well positioned to be advocates for those things. So yeah, thank you.
I have one quick question for you, and that is, you most probably had some preconceived notions before you started this journey, and I'm just wondering what was perhaps the biggest surprise or revelation to you when you completed this work?
That's a great question. I think just understanding the importance of humility and self-reflection. And really, just really being humble in the work that I do has been a really, really amazing learning journey. And just realizing that there's a lot of things that I thought I understood going into my master's, and kind of relearning those and continually reshaping how I think about things has been a really amazing learning journey. And realizing that you're always, I think in my first course with Charlotte, we talked about circular logic and circular learning, and that you're always experiencing and kind of reshaping how you think and understand, and that you're continually learning. So I think that's been, a really amazing journey. Thank you.
Well, thank you.
Thanks.
Thank you very much again.